The following is a demonstration of a healthcare provider meeting with a non-pregnant adult who is open to quitting tobacco. Notice how the provider applies the 5 A's: ask, advise, assess, assist, and arrange of tobacco cessation counseling.
I saw in your questionnaire that you mentioned that you currently smoke, but not every day.
Yes, that is true. I smoke and now I vape too, more days than not.
I also saw that you've been exercising, you've been working on a healthy diet, which is great. So it sounds like, your health is something that's really important to you. I'm sure you know that the best thing that you can do to protect your health is to quit smoking and vaping.
Yeah, I do now. It's been a bad habit for years now.
Had you ever thought about quitting?
I have a lot going on right now, but I would like to try and quit. I've tried multiple times in the past, but it just has never worked.
So it sounds like it's something that's been important to you for a while. You've tried a few times. There's a lot that we've learned over the years about what makes it more likely that you'll be able to quit successfully. Could I share a little bit with you about what we know works in terms of helping people quit?
Sure. I feel like I've tried almost everything I could think of, but maybe it'll work. Yeah.
So, one thing that we know is that combining FDA-approved medications, so things like the nicotine patch or gum, or also there's daily pills that you can try taking, quit coaching from a counselor can double your chances of finally, being able to quit for good. So does that sound like an approach that we could talk about today?
I've tried a lot of those things before in the past, but gave up on them pretty quickly.
And that, one, I'll say that makes a lot of sense. Takes people several tries normally before they're able to quit for good. So those can hopefully kind of be learning experiences that will really be helpful now. And also, usually in terms of, for example, the medications, we want to try to use the medications for at least 3 months, 12 weeks, because we know that that is associated with the best chance of being able to quit for good. And what we can do is really try to figure out what is going to be a good combination that works for you that you can actually stick with. So what I'd like to do is start you out on the nicotine patch combined with the nicotine gum. Does that sound like something you'd be willing to try?
Yeah, that all sounds good. I am kind of worried about the quit coaching though. I just don't have a ton of time in my schedule right now.
So one thing that's been helpful for a lot of my patients that is pretty easy and convenient to use is Quitline NC. Quitline NC is free quit coaching that's available 24 hours a day. So whatever time in your schedule works for you. And you can get it by phone or by texting or through online chat even. So would you be willing to try maybe doing it that way?
Sure. Yeah, I can try that. Usually I just try to do it by myself. So maybe having that extra little push will help me quit for good this time.
Let's think through a few things to help you create a quit plan so that you can be more successful. So had you thought about when you would like to officially quit?
Maybe sometime next week.
Okay, great. Yeah, that's awesome. So if today's Friday, it's a week from now, your quit date could be next Friday. And before, your quit date, we want to make sure that your environment is supportive of what you're trying to do. So what are the things that usually might remind you of smoking or vaping?
I have ashtrays, obviously my vape, and then just like leftover cartridges and things laying around.
So all of those things, those are the things that you're going to want to get rid of in advance of your quit date. Last time you tried to quit, what kind of withdrawal symptoms did you have?
The main one that I remember was having pretty bad headaches.
Yeah, for sure. And we definitely want to get those withdrawal symptoms treated because that, can be one of the main reasons that people will go back to smoking or vaping. Ideally, what we would do is get you started on the nicotine patch and the gum, like I was talking about today, and then kind of see how you can use those to help yourself cut down as much as you possibly can in advance of your quit date. And then that way, if you're having any struggles with it or it's, not working or you have side effects, we can, follow up about that and make sure you have something that works for you in advance of your quit date. So does that sound like something that you could try?
Yeah, I can pick up that prescription today.
Okay, great. The other thing that's really important is planning for those times where it's going to be most difficult to avoid smoking or vaping. So what are the typical times that you feel like would be hard?
Well, I typically smoke the most when I'm around my friends or when I'm on breaks at work.
So are there friends, family, people in your life who you feel like would be supportive of a quit attempt?
Yeah, I definitely think my friends would be supportive, and honestly, my coworkers too, if I told them I was quitting. At work, maybe instead of smoking on our break, we could go for a walk, maybe. And I guess with my friends, if we go out, we can hang out in non-smoking areas or just stay inside in general.
Right. Yeah. Staying away from those smoking areas is key. And it definitely takes, not just you, but also, the support from people outside as well. And then the last thing is, we want to make sure we find a time to follow up. So if we could make an appointment for 2 weeks from now and kind of see how you're doing, see how the quit date went. And if in between that time there's issues, with the medication or, any struggles there, just send us a message and we will follow up with you. When I see you again, we'll talk about kind of what worked, what didn't work, and make a plan to, keep it going. And then the other thing is I will put in a direct referral to Quitline NC. And then that way they'll contact you to get you registered and you can go from there.
Okay. Thank you so much.
Visit YouQuitTwoQuit.org for free resources for your practice, including training on evidence-based tobacco use screening and cessation counseling, technical assistance for implementing the 5 A's and 5 R's in your setting, as well as educational materials for healthcare and allied health professionals and patients. That's YouQuitTwoQuit.org.